A lot of times we find blood, fluid. You were surprised how we get under there.
Each year, 648,000 hospital patients are infected during their stay due to bacteria, and 75,000 die with those infections. Consumer Reports' exclusive new ratings on hospital infection rates found only 6% of hospitals receive top scores for preventing MRSA and C. diff, two of the most serious infections plaguing hospitals today. Staff at Presence Saints Mary and Elizabeth in Chicago helped demonstrate 6 ways you can protect yourself in the hospital. First, know the areas in your hospital room most likely to be infected with germs, and be sure to wash your hands after touching them.
So these bed rails go up and down several times a day. They're in close proximity to the patient. If there are draining wounds, this will be very close to those wounds and potentially acquire a high number of bacteria. Another high-touch area would be the IV intravenous hole that we have at the head of the bed. The same thing goes for the vital signs monitor. Again, this is being touched by the nurses, by the respiratory therapist, and also the computer monitor and the keyboard, which we use for charting, documenting, dispensing medication and vital signs while in the room. This will be another area where we could have potentially many harmful germs.
A catheter, ventilator, central line, or IV may be critical to your care, but prolonged use is linked to serious infections.
If you have a foreign object inside your body, that's always going to be a risk for infection. And this is why we encourage our patients to ask the nurse or the doctor why we need it at that time and how long they should be having it. And it is okay to ask every day.
So the longer the patient has those types of tubes, the more risks there. The sooner we can get those things removed, the less risk for patient infection.
If you're being prepped for surgery, make sure the hospital uses an electric shaver, not a razor.
Skin preparations are necessary for some procedures, for the surgeons to visualize the site that they will be performing surgery on. The clippers are not necessarily sharp, so it will not produce any cut or nick.
Shaving with razors cause skin breaks. They might be minute, might not even notice it, but bacteria sitting on the skin would know, and they would be able to penetrate the skin barrier and cause infections.
Testing for MRSA or MRSA is as simple as a nasal swab, and knowing if you have it can inform your care because MRSA is resistant to many antibiotics, otherwise known as a superbug. You may need to ask to be tested if it's not routine at your hospital.
In the view of our burden of infections overall, it is very important for both the patient and the physician to know what they are dealing with, if they're colonized with MRSA or not.
In the intensive care unit, we do see patients with MRSA. When we get those types of patients, we have to be extra diligent in making sure that we monitor how we take care of those patients so that we don't cross-contaminate another patient and that we don't put ourselves at risk.
Speaking openly about private subjects concerning your body is a common difficulty among patients, but it is key to getting the best treatment.
Patients should not hold back on any kind of signs and symptoms they've had, or anything they're worried about, or the questions they need answers to. It's your body, and so you have a right to know.
I think it helps with a relationship between physician and the patient. It helps both parts understanding the process, and it also helps with the outcomes.
It is your right as a patient to ask everyone who gives you care to wash their hands.
The main documented way of transmission of infections in the hospital would be through the hands of healthcare providers. That's why we emphasize hand hygiene so much, because we believe this is an easy, simple intervention that would create the greatest impact.
And we tell our patient it's their right to ask their nurse, their doctor, or any hospital staff if they wash their hands before actually giving them care.
Hand washing is probably the number one initiative that anybody can do to prevent cross-contamination and infection. So we make it a priority that we monitor and we make sure that people thoroughly wash their hands before they enter a patient room as well as after they're done with patient care.
Hospitals that scored well at preventing infection have clear protocols on cleanliness, drug usage, and infection reporting. See how hospitals in your community compare in preventing infections in our recent ratings. And join our fight to hold all hospitals to a zero infection standard at consumerreports.org/superbugs.